This is a message for all the attendees. We are waiting for people to join in. I can see people are slowly joining in. All the panelists, speakers and the chairperson are all ready to go. We're just holding on so that people can join and test their audio and video. Rather their microphone. Welcome, Dr. Mahesh.
Good evening, Vijay. Good evening, everybody in the panel. I'm still in the round, so I thought I'll just join in and say hello to you guys.
So how is the situation today? You got many patients today to see? Exceptional day, eclipse day, and full moon.
I've finished 110 OPD in this division, another 30 there. So I'm on the roll. I'm doing my rounds now. So I couldn't make out any major differences today, but generally we've had relapses on these days. Family definitely complain of some sort of association between this, moon and their aggression, relapses. I think all the family members who have gone through this are the people who are going to watch for this, irrespective of what explanation I can give or what anybody else can say.
Okay. And what is attendance in OPD? More or less?
No, today is more. We had 110 in this unit. I think Dr. Jagdish also joined in.
Hello, sir. Welcome, sir. Jagdish, sir. Your experience and
hello.
People are still joining in. So your initial comments. I'm waiting for people to join in. So while people are still joining in, your comments, sir.
See, all over the world, it may not be only in Asia. People have a belief on new moon day and full moon day. According to the waves of the sea also, people can have variation in their psychological symptoms. When Dr. H.S. Narayan was there at Nimhans, I remember he was always used to quote, they conducted one study. In the olden days, in the closed wards, pavilions, there were no calendar, there was no TV, there was no radio, nothing. So people were not aware of what's happening outside. So they just did a review. Will there be any extra calls for the duty doctors on those days on worsening of symptoms? At the end of 1 year, they noted down that there were no extra calls nor worsening of symptoms. This is way back, decades back. I think over a period of time, there may be some evidence. We are looking forward today to hear from our specialist speakers. What is the impact? What is the current study?
Yes, sir. Yes,
Thank you, Dr. Jagdish.
Yes, sir. Thank you, sir.
Thank you, man.
Okay. Right. Shall we, where are we now? One more minute and we'll start. I welcome all the attendees. I'm still waiting for people to join. So one more minute and we're going to start.
Dr. IRS Reddy has joined in. He wants to listen to what our expert speakers are going to say today. As promised, he's been on time.
Welcome, Dr. Reddy. Great pleasure to have him.
Okay, it's 7:35. Good evening, everyone. Welcome to this one more interesting session on Telearogya webinar series. Today we're discussing about whether the moon matter to the mind. So today is a day where we have Kartik Purnima, which means a full moon day, as well as today has been a lunar eclipse. I'm not sure how much of India has been affected or is able to witness this solar eclipse. So rather lunar eclipse, but still there is a belief in people, like Dr. Jagdish said, that it can have an impact on the mind. And also what we need to understand is our body is also made up of water molecules at the end of the day. Like, for example, you have MRI scans, which will look into the water molecules, the impact of, or rather the study of water molecules is what is MRI basically. So there can be a chance that there can be some effect on the chemicals in the body. We might have to look into it at a deeper aspect. But before that, we need to understand whether there is a change or a correlation with any differences in the attendance to the emergency department. Even when I was in UK, even senior nurses, they used to say, oh, today is a new moon day. Today we are going to have a lot of people coming with overdoses and things to the emergency department. And these kind of, even people, even healthcare professionals have been saying it. So, but we don't have, whether we have evidence or not, but when I looked at the evidence, there has been mixed kind of reports. Some say there is some association, some say there isn't. So we do have an interesting speakers who have done some work in this area, and we want to hear from them. So let's be, with open mind, let's listen to what they are going to say, and then we'll conclude, and then we can look at doing more work on this area. So with this, and thanks to Microlabs team who have, who are able to provide us this platform at a very short notice with an excellent flyer. And also, I must thank all the panelists, especially Dr. Anil Kakunje, Dr. Rajesh Krishna Bandari, and Dr. Swarna Buddhanayak. At a short notice, they're able to prepare the slides and come forward to discuss this on this day only, so that there is some importance attached to this day. So I request all the participants to please post your questions in the Q&A box, and any comments, please go on chatting in the chat box. You're welcome to keep going on and on and on, as so it's interactive as well. So let me introduce Dr. Anil Kakunje, who is our moderator for today. Dr. Anil Kakunje is currently head of the Department of Psychiatry. Is a professor at Enopoya Medical College in Bangalore. He joined as a senior resident in the department and now heading the same department. He completed his DPM from NIMHANS and then MD from KMC Manipal, and he was the best outgoing student in MD. He authored 3 books and written several chapters in several books, and he has also authored 1,000 plus MCQs and 1555 plus MCQs in psychiatry and psychology, which are available free online. He has around 55 publications to his credit. He has received Professor Raghuram Distinguished Young Teacher Award from IPSKC in the year 2018. He was instrumental in establishing Encourage, Enopoya Psychiatry Rehabilitation Center. His special interests are in psychopharmacology, culture, and mental health. He's also done published some case reports on this same topic. So I thought he was the best chairperson for today's topic. So over to you, Dr. Anil.
Thank you, Vijay, for a wonderful introduction. Very interesting topic for today. So we have 2 eminent speakers and a fascinating, interesting topic on the same day. So we have a Kartika Purnima full moon day. I was just driving to my office now, and I was just looking through the door of my car, and a very fascinating moon. And I think it fascinates everyone. It has been from the historical days, moon has been something of an enigma. So you know few things, you don't know many things. Oh, it is something like that. So people have looked at it from various angles, from the brighter angle, from the darker side. So there are various views to the influence of moon on the mind. The word lunacy itself comes from the word lunar. So it starts from there. Even the word lunacy, it used to be called, starts from the word lunar. If you look at astrological things, you say Chandra affects the mind. The moon affects that is one planet which affects the mind. So from the astrological angle, from the historical angle, even you look at festivals, many of our festivals are celebrated either on lunar days, full moon days, new moon days. It is based on the lunar calendar. So you have various festivals celebrated on various full moon and new moon days. Like you have the Kartika Purnima, the Buddha Purnima, the Guru Purnima, Hanuman Jayanti, Holi, which falls on the new moon days. And similarly, you have the Kartika Amavasya, Mahalaya Amavasya, and things which fall on the new moon days. and people stay away on these festival days, and that can have a bearing on their psychological and psych and mental illness. So there are points for and against whether it influences mind, and if yes, how much. So we have two very eminent speakers who have done a lot of work on this area, and I'm happy to introduce first Dr. Rajesh Krishna Bhandari. He was my junior in KMC Manipal. Nice to have you, Dr. Rajesh. And currently is the assistant professor at KMC Manipal. He was the best outgoing postgraduate resident from KMC Manipal in 2010. He has publications on astrological prediction of mental illness. Currently, he is the research committee secretary for the institution ethics committee, has been a member since 2010. So a lot of interest on ethics and research. He has won several poster awards and is a prominent speaker in TV channels and a common guest speaker. He has about 10 publications, and his interests are in cultural psychiatry and rehabilitation psychiatry. He manages Humbelaku, so people know him, someone who manages rehabilitation. So welcome, Dr. Rajesh. He has done a lot of work in this area, and we are eager to listen to you. I know him personally. He's a very good debater. He puts it evidence-based and to the point. So all are eager to listen to Dr. Rajesh. Our second speaker, Dr. Swarna Buddha Nayak, another close friend of mine. So he is currently the senior resident at Sri Siddhartha Medical College, Tumkur. He has a lot of degrees. He did his DPM from KMC Manipal. He did his MD from Siddhartha Medical College, Tumkur, and currently has joined for PhD in clinical neurosciences at the prestigious NIMHANS, Bangalore. He has, at a very young age, about 10 publications, good ones, and he has won the Young Researcher Award from the SCARF conference at Chennai. He has developed a scale for superstition. So at this young age, a lot of credits. And I've heard him several times. He's a well-known speaker. He's good in blitz competitions, debates. So eager to listen to you, Buddha. So we have two eminent speakers, and I thank the organizers for giving me a platform to share the feelings and moderate the session. So as I've said, from historical days, moon has fascinated. There is an astrological connection. There is a festival connection. There is a naming connection. And all of us in practice would have heard patients speaking to us and telling us that exacerbations or there is a variation in symptoms during lunar changes or full moon days and so on. So I think there is a lot of things at stake for us to learn or know more about these fascinating things. So initially we'll have the speaker one, Dr. Rajesh, giving us his views, and subsequently after about 15 minutes, we'll have Dr. Swarna talking to us, and then the floor is open for your views and answers from the questions and answers and the discussion with the audience. I think this is how we'll go, and I invite Dr. Rajesh to make his presentation. Over to you, Rajesh.
Thank you, sir. Yeah, first of all, I will place my thanks to the organizers for arranging this kind of a topic, knowing that at many professional forums, this is often either told to be disbanded because it's under the lines of superstition. It has been tested many times, and every time we end up getting let's say a debatable or something like inconclusive results. So why then should we keep discussing on this particular topic of does the moon matter to the mind? So one of the simplest explanation is that whether we like it or not, whether we want it or not, moon has somehow invaded in everybody's mind in the cultural context and finds its place as a very understandable explanation for many of them, even though we cannot demonstrate it or explain it scientifically as to how the moon can really affect the mind. Now, when we are living in a world where the culture is going to matter a lot, we can often come into conflict with these cultural beliefs, and that can build or destroy the rapport with that particular individual. So where do we really take a stance on how much to really go along with the cultural belief and how much to really be it very scientific and say that there is no evidence, so let's just brush the matter aside. So in order to understand that, let's go into the evolution of this whole process of how people started associating moon and the mind. So as compared to the initial plan of giving my set of evidences versus Dr. Buddha's set of evidences. So what we thought is I'll give the initial introduction part of it, how it actually originated, how people started making these links, and then the various cultural theories behind it, and then going into the specific evidences part. That evidences part, as Dr. Buddha to really give in more detail, because he has done it in a more recent times with added literature, and I've shared some of the information that I had collected for my thesis way back in 2009. So this is a statement from saying, I see the bad moon arising, I see trouble on the way. I see earthquakes and lightning, I see bad times today. So this kind of statement is often an association which most people across all cultures, be it the Indian or the Western belief system, everybody associates the full moon with something different going to happen, or something often on the bad side. So even if you look at super moon and etc., it looks like a delight to the eyes, whereas those who hold on to the cultural beliefs, for them it's a scary thought to even look at or stare at the moon on those days. In fact, many of these religious explanations as well as traditions forbid on certain days to even look at the moon, because it is likely to create more problems or lead to the wrath of the god on those lines. So the meaning of moon in cultural context, if you have to see, moon gets a weightage mainly because it has a reference for time. So before the advent of the clocks, or before the advent of let's say the Gregorian calendar, etc., so everybody had to follow some kind of a timeline. So for them, the moon became the major time of reference. So they're keeping track of the months, the years, etc., was all based on the position of the moon, as well as the now in reference to the sun and at the let's say to the stars. So that would determine whether it's a new year that is beginning, whether it's a new month that is starting off. So this became a major source of reference to time. So even if you look at religions like the Islam, there also many of their cultural beliefs or the timing, everything is related to the visibility of the moon. So even they follow the lunar calendar. If you look at that way, see, for most of them, it's the moon which becomes the reference point for even to an extent for the direction. If you see, the North Pole or the northern star is fixed, and it's the moon that gives them the actual saying reference of direction. The suns, it can lead to a lot of confusion for them, but moon becomes the major source. Moon is also seen as a symbol of beauty. So even if you look at literature, culture, literature, if you see, or poetry, we find that moon is often a link to the beauty. So any description of beauty. The other aspect where we find the moon getting a cultural context is it being an influencer of fertility. So we don't know the real basis why fertility is enhanced during this time. But if you look at animal behaviors, I think which Dr. Buddha may give some evidences, some of these, let's say the fish or the lower animals, when they have actually seen, they tend to breed more during the, try to go for intercourse or the conception during the period of full moon. So that's often an indicator of fertility. They have also found that certain the hormones are higher, including that of melatonin during the periods of full moon. The other reason why the cultural belief about moon is very high is because it is seen as an important planet with reference to astrology. It's something which is going to matter a lot. It's one of the nearest planet in astrological terms, nearest planet to the Earth, which can have a high amount of influence. So we'll get into the details of this understanding a little later. So when it comes to Western philosophy, we also find moon in relation to evil forces. So if you are looking at the period of the medieval period, vampires, witches, wolverines, and such kind of so-called evil and the forces which are likely to torment the human. So these are all associated with the moon. So they tend to occur more during the full moons. New moon and full moon also enhance sense of ghosts, spirits, and other paranormal forces. This is what we are going to, what we see even in the, we are looking at textbooks which are written for the sake of these paranormal explanations. So you'll find that most of these have an association with the new moon and the full moon. Now, moon and its relevance to psychiatry. So it's like I mentioned earlier, it's a common cultural association of mental illness with moon. Attribution of symptoms to phases of the lunar cycle is a common entity, and special events like supermoon and eclipses often are thought to foretell relapses. So this is in terms of the cultural understanding about moon and its relation to mental illness. So the origin of the word lunacy, I think Dr. Anil had already mentioned in the introduction that it derives from the word lunatics, which means moonstruck. This is from the Latin. So the belief or association of mental illness and moon has been there right from the Greek philosophy side. If you look at Aristotle or the Roman Pliny the Elder, they all believed that madness and epilepsy were caused by the moon. The exact basis of the same were debatable, whereas they felt that it tend to influence the various humors of the body. So why people started associating mental illness with lunar cycle? Because the most simplest and easiest explanation, and possibly the most understandable one, is that lunar cycle is a timekeeper. So everybody had to give a reference as to when it started, how it started, or when did it increase, or when did it precipitate. So everybody would give in reference to, instead of calendars and our Sunday, Monday, Tuesday, and all, they used to talk in terms of the full moon day, new moon day, or so many days from the full moon. So that's where the origin of association with lunar cycle came in. The other explanation is also that moon as a major source of night light tended to disturb some of the sleep routine for many of them. And in fact, some of the adventures, some of the explorations were often taken as taken up during the full moon day, mainly as it would be a major source of night light. And often such adventures were resulting in some kind of a mishaps, and therefore the almost a negative kind of an association with moon and the full moon, and leading to certain problems. Also collective misconception. So everybody believes that it is something to do with the moon. So I also tend to believe it is related to the moon. So everybody starts bringing it in association with the moon. So I also feel that, okay, all these events are occurring because of the moon. Now, coming to the more scientific explorations, where are the theories which are the theories that try to explain how the moon might be influencing the mind? So one of the most tested and most explored ones is that of chronobiology, that is the sleep rhythm changes and its relation to the lunar cycle. A fairly demonstrable entity has been that of the delay in falling asleep, as well as lesser quantity of sleep during full moon day as compared to the rest of the cycle. Now, this has occurred even when they were kept in a light neutral environment. So they weren't exposed to the various phases of the moon cycle. So they were kept in a closed area, and even when it was done so, they tended to have these kind of variations. So it may not be really the light per se or actual seeing the moon that is influencing, but it may be certain other forces is what they started understanding. So the original theories talked about illuminescence or the night light because that was the main source of light for people during those days. And people used to sleep in open, would not have a real roof. So the excess light might have disrupted the sleep. Now this is again a debated entity now because we have other sources of light pollution with fancy lights, disco lights, and keeping lights on all over all time during the night, which may have a higher illuminescence than compared to the moon. The other thing that has been related to the sleep part is that of the changes in level of melatonin during the period of the lunar cycle. So this is the research in 2006 Journal of Sleep, wherein you can see that the average, this the black ones are actually the full moon, not the other way around. So this is the duration of sleep. You can see a dip of sleep happening around the time of the full moon. So this is what they were able to demonstrate even when keeping them in a moonlight neutral environment. So other theories that have been there, magnetic field theory, wherein they feel that the invisible magnetic field that can even affect the oceans and cause tidal waves and variations, they can cause similar changes in the brain fluids. However, this type of theory has been challenged by the physicists who feel that the volume or the mass of the moon, to have that gravitational or the magnetic field theory, one should have an equal amount of mass. So the oceans have a huge, what do you call the water mass, and the moon has its own mass. So only when there is a significant mass to mass interaction, only then one can actually see the changes. Otherwise, the changes are negligible or hardly any such effect can be expected on the brain, which is so small in comparison to the whole to the moon. Whereas the other people who argue it otherwise will say that when it can actually affect a whole ocean, why can't it affect the cerebrospinal fluid, which is such a small quantity, and make the variation? So the other, so that is still a debatable entity. However, physics will not explain this particular theory. The electrical field theory. Now, a certain research has also inferred that there is an increased risk of strokes and cardiac events whenever there are solar flares. So similarly, there might be lunar electrical field which can influence, and during full moon, these effects are higher, and this can lead to the changes in the brain or electrical signaling in the brain. Now, the other one is hormonal variations across lunar cycle. So attribution of lunar cycle to menstrual cycle and its fluctuations. This has been done, and again demonstrated through animal studies wherein the hormonal, basically which can influence the fertility part, tend to peak during the full moon phase, whereas at the new moon phase and other phases, it is slightly on the lower side. So these are some of the theories that have been proposed based on certain scientific evidences. Now, the problems with these kind of hypothesized theories are they are not replicable or demonstrable in all the scenarios. Many of them actually lack the robustness in design, and many of these people who have come up with these theories, they may have their own attributional and positional bias. The other most important factor is that of lack of controlling other factors which could have influenced similar outcomes. So these things make it very difficult for the evidences that are currently generated to really take it in the face value and say that, okay, moon can influence the mind in these particular ways. Now coming to astrological explanation, this is where my research has primarily been. So it's been about how astrology can astrology really predict a person to be having a mental illness or not. So I had used about 150 horoscopes and given it to astrologers 75 of them had mental illness. 75 of them did not have mental illness or their controls. They were all age matched and gender matched, and they were asked to. They were given only the astrological charts without any names, backgrounds, or any other information. So they were asked to predict whether the person had mental illness or not. So it got a sensitivity and specificity of about 75 to 80%. They were able to predict it accurately. Now, my study also has its own limitations. So it's only at a preliminary level that I can say that it has shown some predictive ability. Now, what I'm more going to talk about is the certain explanations that are given in astrology for this. Again, their theories are again very difficult to demonstrate. So they talk in terms of planetary positions and movements as the predictors of human cycles, biological cycle and its variation. So some of them give explanations of the gravitational force. Some of them give explanation of the metals or the elements that are there on these particular planets. Those particular elements within our body may get influenced based on the positions of the planets. So these are certain hypotheses that they have been able to give when I contacted the astrologist in person trying to get explanation. They also acknowledge that these are all not able to demonstrate, as many of the explanations were lost, and we don't have a defined explanation. But the argument still remains that just because a person cannot demonstrate, it does not mean that the explanation does not exist. It's just that we are not able to demonstrate it yet. So these are some of the arguments that they give. But those matter aside, how astrology tries to project the mental illness part. So the moon has a major role in astrological predictions, and moon is it represents the mother, or again the feminine nature. Represents the following body parts as per the astrology. So the mind, the left eye, the chest, breast, menstrual cycle, and blood. So the moon is also going to reflect on how the person's mind evolves over a period of time. It also tells us about how humors are going to get influenced. It also predicts about instincts and emotions in the person. Moon, if you're looking at moon as a house representative in astrological charts, the moon also represents the houses of peace, comforts, and relations. So anything that affects these affects the moon, which means that it affects the peace, comfort, and relations, and therefore leads to mental illness. So,
Rajesh, last 2 minutes.
Yeah, sure. I won't have many more. So it basically says that moon is affected or influenced by opposing forces or is in the house of enemy planets, then it can lead to mental illnesses. Complex interpretations in astrology also are there, wherein out of the 8 major combinations which predict mental illness, 3 of them are attributed to moon, whereas a couple of them are attributed to the Rahu and a couple of them are Ketu, and the other two are more on the lines of Saturn. So malefic moon, weak moon along with Saturn, weak moon in a sinful position at birth. So these are some of the common things that they look for in predicting that this person is going to develop mental illness in the long run. Now coming to Ayurveda and moon, we know that there is a current tendency for push for Ayurvedic research, etc., be it in the COVID situation or otherwise. There is an exploration on the hidden knowledge that was being utilized for over the last 2000 years or plus. Now, in Ayurveda, moon is associated with Kapha dosha. It's associated with feminine body again, and it's tend to regulate emotions, affects prana or life force, may help conception, may help understanding sleep disorder, and helps with menopause. So there are treatments in Ayurveda which are related to moon. One is called as the moon bathing, as compared to our sun bathing to increase vitamin D. In Ayurveda, they do recommend moon bathing as an alternative. It also helps to reduce pitta dosha and reduce inflammation because of the softer rays of the moon. Then in Moon and Rasa Shastra, it talks about how certain things of rasas or juices have to be prepared during certain phases of the lunar cycle, and it has a relation to balancing all the fluids within the body. So two anecdotes before I close. About two people whom I followed across the last 4 or 5 years, and what I have noticed is, including reports from the nursing staff, a person with schizophrenia tended to have periodic anxiety attacks and used to occur only during the new moon and full moon phase, maybe a day before or after, but generally in that period. So he used to have every 10 to 15 days, one or the other anxiety attack. That whole day he will be dysfunctional. And this was consistent over 4 or 5 years that I have been seeing. The other person was with a person with mental retardation or intellectual disability, where he tended to have a cycle of almost 15 days, where in the first 2-3 days he would be very drowsy. The next 2-3 days he would become normal, and the next 3-4 days he will go into a hyperactivity state, and then again, without, even if you don't change the medications or increase or decrease the medication, these behavior tended to persist. So for more evidences from the recent literature, I'll hand it over to Swarna Buddha Naik and then come back for any clarification.
Thank you, Rajesh. So you gave a nice introduction to the topic. So it's over to Swarna for the second half and the second speaker.
Thank you, sir. Thank you for the opportunity. Thank you, the organizers, for inviting. Thank you, Anil sir, for that introduction. And thank you, Bhandari sir, for providing literature. And my talk will not be as interesting as Bhandari sir's, because it will be more on academics. So I will begin evidences that we have, and further what can we find from that. So yeah, these are the newspaper clippings that we commonly see. Previously we used to cut them, now they're on your screen. The media makes it more, the media makes it a little bit hype, that is there. And the media made us think of the studies that we did on lunar cycles. I would like to clarify a bit solar eclipse and lunar eclipse. Solar eclipse is when the moon obstructs the sun, and lunar eclipse is when the sun, earth, and then the moon lies in the same line, in that order. And the most studies have been done on new moon, full moon, lunar cycles, and lunar eclipse. More of cycles and not much on lunar eclipse. On the onset, is it just the psychiatrists who sit with all this and debate all these things? Is it just us who do not find any other thing to think about? No, we have seen, we have renal colic diagnosis, whether it increases on lunar cycles or not, that has been seen. Whether blood loss, whether emergency blood loss or intestinal perforations. So surgery branches have evaluated this. Whether renal colic increases, whether surgical complications increases, and number of daily cardiopulmonary resuscitations, do they increase? Do these surgeries increase during lunar cycles? And none of these are from Indian context. I'll come to that in a bit. So yes, it's not just psychiatrists, it's every other department, emergency surgeons, who have faced this and who have evaluated these things. Is it only India or the Eastern culture that is obsessed about the moon? Again, no. Yes, we have our fascination with the moon, but the studies that I'm going to quote are from Spain, Italy, UK, USA, Germany, Australia and Austria, Denmark, Canada, Iran, Switzerland, Greece, and China. So it's all over the world. So it's not just the Eastern region or India or China only. Now I will come into the academic feature of it. We have evaluated several domains of psychiatric emergencies and other things. So psychiatric emergencies have been evaluated in Spain in a cross-sectional study. I'll come to the results of all this. But first I will tell the domains that have been evaluated. Whether people attempt suicide more, and this was related with climate variables also. More wind suicide, whether the death by suicide was more on lunar cycles, whether rate of psychiatric admissions are more on lunar cycles, emergency visits or self-inflicted burns, are they more? Number of violent and aggressive behavior among hospitalized patients, those are in the hospital. Do they become more aggressive on lunar cycles? What about in the prison setting? Prison setting, do the inmates become more aggressive? What about the contact with community-based psychiatry services? Okay, so in emergency department, we are not able to call them. So can we call the community-based psychiatry services, and is it more on lunar cycles? What about consultations for anxiety and depression? And again, suicide deaths, again, whether in disabled adults. So it's developmentally disabled adults. It's not who can, and in this study, they used mild to moderate mental retardation. So not the normal cognition that has been affected. And what happens to those people in a lunar cycle? Again, suicide, again, misbehaviors, and in women has been, as Dr. Bandari has said, there has been more correlation with menstruation and female hormones. So was that more in women? What about parasuicide admissions? Again, suicide, completed suicide, crisis calls, psychogenic epilepsy. So there are variable domains of the literature that has studied, and none of these are in Eastern countries. Most studies have been done in sleep, whether sleep and physical activities change during the new moon or the full moon. What is the subjective and objective variables of sleep? Does the person think that they sleep more or less? Because sleep has been shown that may have relationship with lunar cycles. Measurement of insulin sensitivity, appetite, and blood pressures. So it's not just the subjective reports or objective scales, it's also the lab investigations that have been correlated. And dream recall with lunar cycles. So now we can see that there are so many domains that have been studied. And the best part of this, or the worst part of this, is that none of these studies that I have told, about 25 studies of different domains, they have not found any significance. They have found either statistically insignificant results or their significance is not valid. About 24, 25 studies all over the world in different domains have not found evidence. So when we talk about lunar cycle, we keep talking about the evidence, but we cannot dismiss the evidence that has not been found and has been tried methodologically sound. What are the evidences that have been found? A few of them. They have found that medically unexplained stroke. So again, this is something spooky. They have not tried medically explained stroke, they tried medically unexplained stroke, and they have found that it increases in full moon days. And moreover, they have again seen appointments for thyroid outpatient clinic. I do not know how did they come to this conclusion that they will test thyroid only, but they did, and they found that it is again increasing in full moon. What about psychopathology? Does it goes bad? Do it go bad? And yes, it does. And especially in schizophrenia, the quality of life during the full moon days, they go down. Number of diagnoses of specific psychiatric disorders. Now, this was one of the first studies done in India and was later also followed up and commented upon. And they found that during that time, there was a diagnosis of schizophrenia or non-affective psychosis diagnosis, and that increased during full moon. Seizures. Yes, one study have found in Greece that seizures tend to cluster around full moon days. What else? Violent and acute behavior. Yes, that can increase during full moon days in Australia. Now coming to specific sleep characteristics, what they find is that there has been decrease in sleep efficiency. There is median sleep time is low and increased REM latency during full moon. Again, full moon. Sleep structure and EEG activity, NREM, melatonin, cortisol, all have been evaluated by Kajushan. And they have again found that this becomes more or deranged during the full moon. Della Monica, they studied on the subjective objective parameters of sleep and again found that it relates to the various sleep phases. Phase 2 may be more during lunar cycles. And sleep duration, it is more during full moon and increase during, there is increase of sleep during new moon. Now, this study is very important because till now, the studies that have shown evidence only in full moon. Now, this is a significant point that we will come later. And what are the other things that have been said? Yes, nutrition, whether they take more alcohol, yes, that has been found to be associated on more on full moon as compared to new moon. This is done not in India, so I don't know, but in India there would have been an association because holidays are on full moon. Most of the festivals are on full moon. So yes, there will be more alcohol. Absenteeism, do people bunk more on full moon? Is for some reason they do. There is slight differences in absenteeism in full moon. And pregnancy, I saw a chat in whether there is baby boom. And in pregnancy, yes, Japan had seen once, and they had seen the cohort for 1,000 babies, and they did not find anything with the lunar cycle, but they found more on the gravitational pull. Now this cannot be interpolated that gravitational pull pulls the kid out of the mother's tummy. That is not right, but this has been found. Now, all these studies, all that I have shown is having a 1:2 ratio. 1:2 ratio is that if we have one part of studies showing that there is a positive correlation, there are double of those studies showing that there is no positive correlation. So I showed 12 to 13 studies which had correlation and 24, 25 which did not. So that is something to keep in mind. Moreover, very recent studies, bipolar. What about bipolar? They found that 17 bipolar patients, their cycling were dependent or were related to the circadian rhythm, and bipolar rapid cycling may be associated with this. This is a 2020 study in China, and they evaluated for 13,000 patients whether schizophrenia was associated with lunar cycle and whether the admission rates were associated. And they found that schizophrenia was more commonly to be admitted during the full moon phases. Now, again, I will come to this later, but admission and discharge rates are not really the good ones to see because they are not dependent. They're dependent more on other factors like bureaucracy and whether the hospital allows you to get discharged on that day or whether it's a Sunday, whether it's after 3 p.m. or 4 p.m. when the resident is tired. This is again a recent Indian study, and they evaluated about 18,000 patients admission in psychiatric wards according to the full lunar cycle, and they found nothing, no connection. This is a recent negative study that has happened. So then I come to the studies that we have done. One of them is the whether lunar synodic cycle affects sentinel events. And my co-author is Apurva Mittal and Ravindra sir, Sharma sir and Samir sir, all are from KMC Manipal. And it recently got accepted for Chronobiology International Journal. And what we did very shortly, we wanted to see whether admission rates and occurrence of sentinel events in the psychiatric ward, do they correlate with the lunar cycle? It was a retrospective study with about 780 people. And what we did a little bit of on this, which I would recommend that people follow because this is a Kannada Panchangam character, and you can see the white thing is the full moon, the Hunnime. And we took 1 day before and 1 day after, and on that day, so 3 days we took as the inclusion criteria because the full moon may stay on the other days too, on 1 day before and 1 day after. Then the black thing is Amavasya. Do not confuse, new moon is equal to no moon. So it's the dark moon. And again, we took 3 days, we took 3 days before and after. For controls, as Bandari sir had told that controlling is difficult. So for controls, we took 3 days in between them. In between them, 3 days which were having no effect on of the moon. And those were one control area. And similarly, in between the full moon and the new moon day, we had again one control area. So 6 days for control, 3 days for Purnima and 3 days for Amavasya, 3 days for new moon and 3 days for full moon. And what we found, we evaluated multiple sentinel events like physical restraint, chemical restraint, whether patient absconded, seizures, dystonia, whether there were accidents, whether there were suicides, whether there were deaths. And we did not find much. We did not find much correlation on these sentinel events apart from very significant results when it came to chemical restraints, that how many patients were given chemical restraints. That's your IV haloperidol, lorazepam, phenargan, promethazine, things like that. And on the left side is the full moon, new moon, and on the right side is the control days. And when we take, so few patients will be given both on full moon days, new moon days, and on control days. When we take out those control days, we find a significance. We find a deep significance that there are more patients are being chemically restrained on new moon and full moon day taken together, not taken individually. Again, when we see a patient may be requiring sedation more than once, so we saw the frequency of sedations and about 500 frequencies were calculated. Again, we found a significant relation that in full moon and new moon, there were more frequency of chemical restraints. Chemical restraints can be either oral or parental. So we evaluated that also, and we found that parental restraints were more during these lunar phases. And oral medicines were also more in these lunar phases, but parental had a more deeper significance. Next we come, when we took all the significances together, all the restraints together, remember that we did not find anything in physical restraints, only in chemical restraints. But when we took physical and chemical restraints both together, then again we found a significance that it's any type of restraints, they're used more on the full moon and new moon days together. Again, I'm stressing it's together. So whether it's alone on full moon or alone on new moon, we did not get any significance. When we added both of them, we found that there were significance. So this is the chart that we found significance, that chemical restraints were more, chemical restraint frequencies were more, IV and IM chemical restraints were more, oral chemical restraints were more, all restraints and all restraints frequency, all these parameters were more in the lunar cycle, in full moon and new moon. Now, a similar study was done in Kasturba Medical College in 2007. Now, this is personal communication with Bhandari sir and Anil sir. Anil sir is the moderator, and they also found that they also tried to evaluate SOS medications and whether they were used more than usual in inpatients. They evaluated about 550 patients, and this was a prospective study. 250 were done prospectively. And they used a similar methodology, that one day before and one day after, but they did not find any significance done in the same center about 10 years before we did in the same center. A lot of this material has been covered by Bhandari sir in the previous talk, and the biological underpinning mainly comes from Zimeki's article that lunar cycle has more of physiological basis on animals and human. The fertility, menstruation, and birth rates are related to it. Melatonin levels can fluctuate with it. Lunar cycles may have effect on other hormonal changes that is seen more in insects and in fish. And it is also seen in mice and sheep. So there are, in animal kingdom, there are relation with the lunar cycle. The possible theories, one is the gravitational pull and centrifugal force. I was seeing in the chat that a person was saying, yes, gravitational pull has been recommended. As Vijay sir had told in the beginning, MRI is basically seeing the water molecules. We are made of 70% of water. So if the moon can pull up the seas and the oceans, can they not pull up the tiny water particles that are there in our brain? And do they have an effect on it? Now, sadly, most of the studies have shown, which have evaluated this, have shown that the effect of gravity is very low on our brain, and it cannot have so much effect as such as mental disorder due to the gravitational pull of the moon. This circadian rhythm, this is the forefront after the gravitational pull was taken out. So yes, there are some decreases and increases with body temperature, melatonin, and do this relate to the moon and the lunar cycle. Sleep deprivation. Now, this was a previous hypothesis that yes, brighter moon, the full moon is actually 200 to 250 times more bright than the normal night, than a no moon night. And okay, so someone is sleeping outside. Yes, this can happen, but we don't sleep outside anymore. We have candles and we have other lights going around in our room. Nothing disturbs us. So this is again not. But sleep deprivation is a very important topic because sleep deprivation relates to psychiatric illnesses. And most of the studies in sleep have shown some differences in full moon. Now, evolutionary, we have all evolved from the water bodies. Now, fish, they may have a tidal sensitivity to the pull of the moon. And we, as we have evolved, we may innately have a tidal sensitivity in us. But this is only conjectural and this is not proven. The main thing that comes is from the Transylvania effect. We all know the stories. Yes, sir.
Last 2 minutes.
Yes, sir. Yes, sir. So yeah, in Transylvania effect, we see that the werewolf will come out on the full moon day and will give a large cry, and twilight fans will go haywire. Yes, that happens in movies. That happens all over the world now. Germany, European countries, American countries, they have all told this. But is there a relationship, biological relationship? We still do not know. What we propose is it may be pathoplastic, pathofacilitatory, that it is inbuilt in our mind that the moon is important. Bhandari sir had told that whether you like it or not, the moon is above you. The sun throughout the day is important. The moon really does not serve any purpose at night. It's not bright enough. It does not help us. So why it is there? So maybe with that relationship, we have come to a Transylvania effect. Now, also something to ponder, that why most studies have shown significance only with full moon. Even our study did not find significance when we were seeing separately. Now, if you think about gravitational force, it will be same on the full moon and it will be same on the new moon. So that theory goes out. It's only about brightness or only about circadian rhythms that can still persist with the full moon preference of the psychiatric illness. So first we will go in way forward and way backward. First we'll go way backward. So what is the way backward from this? We have faced bias in publication of such studies. We personally have faced, the reviewer had written that these studies are not important. They will only bring the journal back from the advancement of biology. We do not like that, of course. Start saying that these things are not real, and start thinking that, okay, let's not hypothesize on this. These are the way backwards. Think that either of the investigators, whether the JR or the principal investigator or your teachers, they're into some sort of black magic and shamanism, who is saying that, yes, moon is important. And once you find and once you do something about the moon, do not think of yourself as considering the person who is bringing back moon to the Indian culture. So these are the way backward. Way forward, we need a more homogeneous sample based on lab investigations, based on beliefs, based on socio-demographic values. We need strict conditions of restraint. Who applies restraint? When it is applied? There should be a strict objective criteria. We should evaluate the patients for the beliefs, the participants. If I don't believe in lunar cycle, and I still don't believe, although the study shows, I do not believe in it. But we should believe whether the patient believes it or not. We should evaluate that. Yes, Ayush, can it be integrated with this research? It's been integrated anywhere, so why not here? And lab tests, a few studies have done it, and they have found melatonin and other lab tests to be rising and falling. The last slide is probably the most important slide from my side, where. So I have proposed 4 types of studies. Being invited to speak on telearogya on the full moon day, I think I should do a case study on this. Do people listen more to The Dark Side of the Moon by Pink Floyd, on lunar cycles, a narrative experience? These are the studies that bring you nowhere. Is brightness of the moon, can they be used to wake up residents for midnight emergency call? A proof of concept. And the last study is actually inspired by one of my friends. Do couples quarrel more on eclipses? A survival analysis. Thank you, and thank you, the organizers.
Thank you, Swarna, for a very spirited presentation. It was a good 2020 presentation, both from Rajesh and Swarna. I think there are points for and against the topic. People may be in between the two and or in the spectrum. So many things have been covered with, in relation to mood, right? From accidents to psychiatric illness. One of the studies which I remember is people looked at accidents on new moon and full moon day and concluded that there are more accidents on those days compared to other days. But then subsequently some other person did an analysis of the study and said more number of new moon and full moon days fell on weekends, and that's why accidents are more, because probably people are under the influence of alcohol. So you have points and against these things, and people look from various angles. I think we'll take few questions from the audience. One question we have from Dr. Namrata, who has asked whether bipolar illness has any special connection with the, say, new moon and full moon days. Anyone wants to take it? Rajesh?
Yeah, I think Dr. Swarnabuddha gave one study also. I think the Ware et al. In 2017, where he specifically looked into bipolar disorder and even came up with that concept of, I think that he called it some Sneap effect or something, no? Wherein it's not just the lunar cycle of 29 days and all, whereas the closest part, when the super moons etc. occur, about 206 days, that's when the actual risk is highest. And the person had specifically followed up a group of rapid cyclers and found that during these situations or the full moon effect, that's when they had most of the relapses or the switching occurring. So technically, it's any sleep disturbances will worsen any psychiatric condition. Bipolar disorders are more prone for that. And somehow, because of either the chronobiology or the luminescence theory or the hormonal variation theory or the melatonin fluctuation theory, so sleep is somehow influenced by the lunar cycle. So that may be the basis why bipolar disorder may be relatively more prone or affected. If you look at even epilepsies, I think that's another place where the lunar cycle effect has been demonstrated, and whatever be the theories behind it, we also look at bipolar disorder somewhere coming as a long duration of epileptic behavioral disturbance. Even we consider that under that. That's one of the reasons why mood stabilizers may also be useful in bipolar disorder. So whether they may have a similar explanation. I think even other studies had found about dissociative disorders, etc., being more in relation to full moon. It may be again more to do with the cultural beliefs of behavioral disturbances and accepting behavioral disturbances during these lunar forms, the new moon and the full moon. It may be more culturally accepted also during those days. So that's why there may be a more tendency for these episodes to occur during the full moon.
Yes. Another interesting area is probably lunar cycle and the menstrual cycle. Both are of 28 days roughly. So it's a very interesting correlation, and many people have looked into it also, whether childbirths are more during these days, whether there is increased, say, reasons or in animals, as Rajesh mentioned, say, increased mating and things like that happening during new moon and full moon days, whether there is any relation with moon. So I was just wondering why we call, say, the first trip after marriage as honeymoon, whether it has any connection to that. Yeah. People have even got fascinated with the moon in relation to novels and say movies also. So you don't have a horror movie without showing the moon. If Dr. Indus Ramasubba Reddy sir is there, I would like to hear him his thoughts, because he is quite interested in movies. And sir, your thoughts, are you there? Is Dr. IRS Reddy there? Okay. Maybe he'll join later. Anyone else? Anyone wants to ask any questions directly to the speakers?
Yes.
Very interesting. Very interesting.
Hello.
Yeah. Yes, sir.
I am Dr. IRS.
Yeah. I was just waiting to hear you.
Yeah. No. Because there was no audio connected to me. I was mute. Anyway. No. Excellent. I enjoyed the talk because I am very much interested in this type of topics. Anyway,
Yes.
In 1965, Dr. Abraham Varghese did a study from CMC Vellore. I don't know. I thought one of the speakers will quote this on moon and mental illness. It was published in Indian Journal of Psychological Medicine. So if somebody can throw some light on that, number one. Other thing is if there is no evidence, why the tides are so aggressive, sea tides and the full moon days? Because this is a factual experience for most of us.
Yes.
So probably, I think first, if one of the speakers can answer this one or two things, then let us go to the next one.
Yeah.
Sir, good evening. I will answer the second question. First question we have missed the article. The second question is that yes, it's very intuitive to think that when the tide can be pulled with so much force, why not in our brain? The thing depends on the mass. Now the mass of the ocean is huge compared to the mass of water that is in our brain, including the CSF. So the pull is not as big as we think from the conjectures that the oceans are being pulled. So it depends on the mass. Although the heights are also in millimeters in the brain, but one or two studies have seen, and they have seen that the neurochemicals, they do not follow a physical attraction on the lunar cycles or on the gravitational force. In the other way,
that I agree, but why the tides become so aggressive on that day? So is there any link between the full moon day and the tides becoming very, very aggressive on that day, at least, if not on the mind?
Probably the gravitational pull becomes more because the moon comes a little bit closer to the earth on those days. So that is one explanation why the gravitational pull is more. One anecdote that has been told in this conjecture is that if a person is held with head down, will the neurochemicals reach more to the cortex? So the gravitational pull do not help in our cortex, but yes, in the sea, in the ocean, definitely. And it does in the ocean living creature, in the fishes and in shark, definitely the fertility depends on it.
Okay, thank you. But anyway, both the speakers have done an excellent job. Very interesting. I think this is a very rare topic which we don't discuss usually in any one of our conferences. Probably they have thrown a lot of light, especially the very recent research and research material also, the studies and other things. So I thank the team, the Telearage team, for doing arranging within a short time about this particular on this very auspicious day like Kartik Purnima. Anyway, I think please go ahead.
Dr. Anil, you're muted.
Sir.
Yeah. I just want to add to what Swarna has said. Why it affects the tide so much, but not the mind. The gravitational pull, as he said, affects more the open water bodies and not the closed water bodies. So that is the reason why it may not affect the mind, and it affects the high tides, which is more of a open water body.
Okay.
Yeah. I think Rajesh, there's a question on religious and cultural festivals and aspects and related to psychiatric illness by Dr. Srinivasan. So can you throw some light on that?
Yes, sir. I think it again dates back to the timekeeping. So most often, if you look at which day to fix for any festival, olden days, your Bidige, Tadige, or the second, third, fourth day and all, they can be very confusing. Whereas new moon and full moon can be a defined day. It's easy for anybody to pick it up. So that's possibly the reason why most of these days get celebrated on those particular days. The other aspects could also be that if you look into Ayurvedic explanations, so they also offer certain types of meditations to be done on certain full moon days. Now, whether it was culturally integrated in the form of certain traditions or certain festivals and rituals to do certain types of a dietary change, to do a certain type of chronobiological change, to do a certain type of prayers, etc., as part of warding off the effect of the so-called lunar. That's something which is yet to be explored. But when I looked into Ayurvedic books, they do talk about doing certain types of diet, certain types of meditations or prayer as a means, and yoga as a means of warding off the hormonal variations, the mood variations that can happen during this moon. And I'm just saying about mood, etc., because from the psychiatry side, it can technically affect any other parts of the body also. If you look, moon is attributed to kapha. So anything that affects the kapha system can be changed.
Yeah, absolutely. Just to add to what Rajesh has said, probably physical activity is also more during those days. That also can influence your psyche, because you have celebrations, activities, preparations, and so on. Sleep deprivation, all these things can really lead to exhaustion and can precipitate psychiatric illness. More so things like acute psychosis, bipolar illness, and so on. We have eminent people in the audience. I think Dr. Sharma, I'm a teacher for all of us, someone who has guided many of these such topics. So I think if sir is there, he can throw some light on this topic. Sir, are you listening to us?
I don't think Sharma sir is there.
Anil, you need to make him allow to speak. If you go to...
Yeah, just a second.
Do you want me to let...
Yeah, can you do it?
Go to participants. Yeah, go to participants and...
No, I don't see his name now. I think he is left.
Yeah, I think he's left. Okay.
Okay.
Dr. Roop Sidana wants to say something.
Yeah, yes. Dr. Roop Sidana is there?
Yeah.
Go ahead, sir.
Unmute and...
Yes.
Please unmute and go ahead, sir.
Sir, you can go ahead.
Unmute and go ahead. Yeah.
Yes.
It's been a wonderful experience listening to both the speakers. And I just want to know if there are any studies on normal people on lunar cycle effect on the mood and activity. Hello?
Yes.
Sir, yes. There are studies in, there is one study about religious activity and good mood during the month of Ramzan with lunar cycle. So they have seen only 1 month. Generally, the mood in the Ramzan is upbeat. So they have compared that. Does the mood get a little bit low? But as of what I have found, no, I have not seen in healthy controls. Lab investigations have been done in healthy controls, and they have not found much significance. But whether the lab tests become as significant to elevate or decrease the mood, we do not have data yet.
Yes, sir. Even I haven't come across many studies. It's mainly those sleep-related studies which have, and the other one is on the menstrual cycle. These are the two places where they have done it on otherwise normal population.
Yeah.
Sir, if I may be permitted, I wanted to add one comment about the animal studies.
Yes.
With regard to the fish part. So the other factor that can actually influence the fish behavior during the tides is also that, or so-called the fertility or the mating. Eggs within the sea or under the floor of the sea may get disturbed, whereas during these tides they can actually go to the sand. If you look at, I think Guineans, or there is a particular fish which actually floods the beaches and fertilizes during the low tide, and lays the eggs. They close that whole area and they move out, and then during the next tide the eggs hatch and the whole fish return. So it may be other factors also which are influencing that particular behavior rather than just the lunar effect only increasing the hormonal levels, etc. It may be the planning for the safety of the eggs that they may be actually doing it. So this is the other viewpoint.
Yeah. Dr. Naresh is there. Sir, we want to hear your views.
Yes, I mean, it's not my views per se, but as of now,
Yes.
we can say that there is no evidence. The right
Yes.
statement, there will be no evidence to disprove the non-effect of the gravity of the moon. Right. So we can't categorically say that there's no effect. But what I mean to say is that again, but why are we just focused on the brain itself? Are we concerned about the diseases of the other parts of the body as well? Does moon have the effect on other parts of the body? So that's what also we need to think about. Like, but I mean, if our say ancient or say earlier researchers have shown or they were given so much importance to the moon and the lunar and the lunatic kind of words and all. So do they have any significance? Or, I mean, why should they have any significance? We need to look into that as well. So that's what it means. So we can't discard anything unless categorically we disprove them. Like, that's all I wanted to say.
You are absolutely correct. I think people have looked at from various angles. We even had people looking at stock market returns with the lunar changes, and whether people are getting more returns or less returns, and whether people are moon stuck.
Right.
And so, from health point of view also, and across various specialities, across various countries. Yes. Anyone else from the audience want to share their views or ask any questions to the speakers? You can either write your questions or directly ask.
This is Dr. Jagdish. This
Yes,
question is for Dr. Bandari. A
Yes,
lot of astrologers believe
Yes, sir.
moon in the 7th house afflicts the mind, and when they are passing through some dashas, so
Yes, sir.
afflicted and they are high risk for mental illness. What was his impression?
So if you're going through the astrological principles, there are two aspects in it. One is the innate nature, the birth chart, which actually says how much of a, I would possibly call it under like a stress vulnerability model. And one is the stress vulnerability is brought out in the birth chart itself. Whereas the dashas, antardashas, or the planetary periods, interplanetary periods, they are the periods where the actual trigger happens and they end up with an episode. So bringing it into the psychiatry understanding, this is how I can relate it. Now, within dashas and antardashas, we can keep digging further because one anecdote that I can give is about a person whom I tried to do a follow-up. And the astrologer had initially predicted that the person is going to be fine after 6 months. So unfortunately, the person had committed suicide at about 3 months from the baseline date. So when I just asked the particular astrologer, so is it possible that this person could have committed suicide in between? And asked when. So he was able to come down to the day when it might have occurred, because the reason he gave was, I just looked at the day one baseline and the 6 month later deadline, and looked at the planetary chart on those days, and accordingly I predicted. Whereas if I have to see each and every day, then each day I will have to go into much more detail. So it became such that he had a moon already in the bad phase, and he had a Rahu Dasha with a Ketu Antardasha, and we can keep having sub dashas under it to the reaching of even seconds. We can reach to that extent. But to do that kind of an analysis for one particular day or one particular event, they will have to spend at least 4 to 5 hours to reach to that level of specification. So that was not defined in my study. So that became one of the drawbacks. But this is somewhere they say that no, that is their explanation. How one is in general, the birth chart predicts certain things about the personality, certain things about the proneness for getting into a mental illness. Whereas dashas and antardashas, they actually tell when it actually starts, when it can actually end. So that is the astrological explanation.
Yeah. Thank you, Rajesh. Do you have anyone else? I think we have covered almost 1.5 hours, more than the time actually allotted to us. So shall we close, Dr. Vijay?
Yeah, yeah.
I think we had a very interesting discussion, and right from say moon and psychiatry, moon and medical illness, moon and accidents. We have something like moonlight dinners, moon massages, moon baths, honeymoon, and whatnot. So moon does matter to mind. Whether it actually influences or not, we actually don't know, and we need further research. But then it actually matters for people on the ground, and probably for people like us who are actually treating people. And it is something which is we need to understand a little more. Both the speakers have been extremely good, well read, well prepared, and it was a pleasure chairing the session and moderating. So thank you, Dr. Rajesh, and thank you, Dr. Swarna. It was a pleasure interacting and having a session with you. I thank the Telearogya team, Dr. Vijay, Dr. Jagadish, and Dr. Mahesh for giving me an opportunity. We had a wonderful audience, and I think all can go for a moonlight dinner. We have a full moon night. We can have a moonlight dinner today.
Thank you, Anil. Thank you,
Thank
Swarna
you.
Buddha. Thank you,
Thank you, sir.
Dr. Rajesh Krishna Bhandari. At a short notice, you were able to prepare and make us a very, you prepared us for a, you sparked something in our minds so that we can think of more into details of these things. And I think this will be again discussed in few years time again, and then we probably would add some more literature to this. So this will continue, I guess. But at a short notice, you were able to do so much. I'm really glad. Thank you very much, and thank you, IRS Reddy sir, and also Dr. Roop Sidana, and also all the participants who were in the background and were listening carefully. And without participants, we cannot do this. At the end of the day, I will say that for Telearogya webinar series, it's the participants who matter to us and their time. So thank you very much, all the panelists, for a wonderful evening. And I thank
thank you
team.
all.
I thank Microlabs team as well, and Nawaz and Mr. Ganeshan for giving us support and hosting this event. And this will be sitting in the YouTube also. So anybody wants to view this, you can share, and so that they can also say there's definitely some learning out of this. So I guess that will help them. Thank you very much, everyone.
Thank you all. Good night.
Thank you, sir. Good night.